Hello everyone. Today's the topic is PPH. The PPH, its name is also defined as the postpartum hemorrhage. So it is one of the part in obstetric and gynecology. So we in this video we know what is PPH, what are the types of PPH, cause of PPH, pathophysiology, sign symptom, medical management and nursing management. Okay, first we go for the definitions. In PPH, what it's defined as the excessive bleeding or loss of blood after birth of the baby within the amount, that amount should be of 500 ml or excess of that 500 ml, that occur within 24 hours up to 12 weeks of pregnancy. Okay, so the amount, it must be quantitative definition is there and qualitative is there. In quantitative, you know the amount of loss is 500 or more than that. Here up to the 12 weeks of puerperium, which adversely affect the general condition of the patient. So continuous bleeding leads to a deteriorate condition, that is rise in blood pressure and rise in pulse rate and fall in blood pressures. Okay, so there are two types of PPH. One is primary PPH and another one is secondary PPH. In primary PPH, what happens? The loss of blood after birth of the baby up to 24 hours. And in secondary PPH, it is beyond 24 hours to 12 weeks of puerperium. Then what are the cause of PPH? Those who are more prone to PPH. One, the cause is atonic uterus. Atonic uterus means no successive, where the successive contractions not takes place. And traumatic conditions means during normal delivery you are using forceps, ventouse delivery for the extraction of the baby. That case, if there is any tear inside the wall of the uterine, inside the area of cervical or the vaginal wall, so that may lead to bleeding. And retained tissue of the placenta. When we deliver a placenta, it's very gently we remove the placenta from the uterine wall. Softly we move the hands on the wall of the across the wall of the uterus and remove that. And the removal of the placenta is done by the control contractions also. In that case, if there is any retained particle present inside the wall, that leads to bleeding. And also blood, women having the disease like blood coagulopathy, they may suffer PPH during the time of delivery. Who are high risk factor, which women are more prone to PPH during the time of delivery? One is placenta abrupto. What is placenta abruption? The abruption means eruptions or the separation of the placenta before time of delivery. Okay, this is also in one cause in the APH also. And placenta previa. Here the placenta, we know placenta is always posterior wall of the attached to the posterior wall of the uterus. In placenta previa case, the uterus is attached to the anterior wall of the placenta is attached to the anterior of the uterine wall. So that case, bleeding may be start. And multiple pregnancy, women having birth of 2-3 more babies, successive pregnancy, that is one of the reason of PPH. And anemic condition where the hemoglobin is very less, that is less than 6-8, in that case also the women face with PPH during the time of labor. And prolonged labor, if the labor during the process of delivery takes long time, that can also face with PPH. Why PPH is occur? That is pathophysiology. Here we know, due to that, you see this is the uterine wall and the placenta. The placenta is attached to the posterior uterine wall by the number of vesicles are there. The vessels throughout the pregnancy, they supply oxygen and food to the fetus. During time of labor, this contraction takes place in the uterine wall. That helps for the removal of the placenta. If there is insufficiency of the contraction in the uterine wall, that leads to PPH. So in that case, if in the uterine contraction is not successively done by the uterus, so the retained part, the vessels remain open. You see, if there is they are interconnected, vessels are interconnected. If during contraction the vessels close and the opening will be closed. If contraction is not sufficient, the vessels remain open in the delivery also. So that leads to bleeding. Okay. So here, due to the uterine contraction, the delivery of the placenta, the uterine contraction, blood vessels are compressed. Opening of the blood vessels to be closed due to the put pressure on the vessels opening is closed. That leads to stop of bleeding. But in PPH, what happens? Due to the insufficient contractions, the bleeding takes place and patient go to the condition of shock. Then what is sign and symptoms? Signs and symptoms, one is that is uncontrolled bleeding, and second one is fall in BP. So as the blood pressure is decreases, that leads to dizziness condition, blurriness of vision, feeling of faint also, and all the decreased heart rate. One of the vital is that is heart rate is increases, and nausea and vomiting sensation that arises in the patients. The patient complaining of nausea and vomiting also. And how to diagnose the patients about the PPH? In diagnosis, we first go for Rbc count. One blood test will be done for the count of hemoglobin level, and also for ultrasonography to find the image of the uterus to see any retained particle present inside the retained particle of the placenta present inside the uterine wall. So here also we immediately go for grouping and cross matching to at least 1 to 2 units of blood ready for the emergency conditions. So first one is the medical emergency. It is the first priority is given how to stop the blood. So continuous messaging of the outer side of the abdomen, so that the uterus and contractions, the successive contractions should be arises in the uterus, and give medications like oxytocin injections to stimulate the contractions. And this oxytocin, you should know, this injection oxytocin also given just after the delivery of the anterior soldier of the baby for the contractions. And removal of retained part of the placenta is after delivery of the baby. The placenta delivery takes place. So during the delivery, when you are removing the placenta, first to inspect the placenta, it's correctly all the part is removed or not. So inspection of the placenta, that is removed from the body, and if any retained particle is present or not, that to be checked. And repairing of the cervical tear, if there is application of some ventouse or forceps delivery, that case, if there is any tear to the wall of the cervix or the vaginal wall, that tear to be repaired by suturing and giving the gauze packs also, and packing the sterile gauze pack to the stop bleeding. And if this not solved, then we go for immediately blood transfusion. Then nursing management, as the nurse who are working in the hospital sector, in the labor room, we should first monitor the vitals of the patients. Vitals, blood pressure, temperature, respiration, we should be continuously recording of the vitals on the chart. And observing the amount of blood loss, how much amount of bleeding happen after when the woman is coming from the delivery of the patient from the labor room. We should first inspect the amount of loss of blood. Okay, if how much gauze or the sterile fed are required for that woman. And during if the patient come in the delivery also, in that antenatal period, we should be screening the patients who are very prone to PPH. We should educate them during the antenatal period also. As you know, these are the risk factor: placenta abrupta, placenta previa, multiple pregnancy, NAPA, and prolonged labor. That's in few cases can be find out or identify those women who must be chance of PPH. In the antenatal period, there should be screening of the patient, those who are chances of PPH. and routinely giving oxytocin injection to the further uterine contractions. In the internatal period, what we do? We give injections oxytocin to observe the contractions and for the good contraction for the delivery of the placenta, and ensure the intake of iron in the internatal period. If the woman is coming for 2-3 checkups, that time also we advise them to intake of irons and to healthy diet to avoid the case of anemic conditions. Okay, and those who are in high risk, they should be advised, or for the they should be already there should be aware about the PPH also. Be ready with 2 units of blood for the emergency. If such high risk patients are there, they going to the labor, that case we already kept 2 units of blood for emergency conditions to avoid such mishappenings or any shock conditions. Okay, this is all about our PPH. In next video we see other subjects. Okay.